morning. My name is Hadrian Mangwana, and I'll take you through this presentation, but I'm not sure if I'm the right person to be taking you through this presentation. I would have wanted a child come and present this, because I think it talks to vulnerable children and the conditions they live through, and no one else can say that better than them. But anyway, today I'm just going to go through the presentation myself, if you allow me. Okay. Almost everyone in this room, if we look back, we look at our education from where we started in primary school to where we went, to the degrees we got, to the research we are doing now. All that we can attribute to the education which we received as children until we became adults. The road we took to get there is different for all of us. So, but what we all know and what we all appreciate while we are here is that when we have education, it leads to poverty reduction. It improves the health outcomes. It also allows people to participate, the children to participate in the world, in their day-to-day life. So, in 2023, Namibia had about 72,000, more than 72,000 children living with HIV. And then most of them, they struggle with going to school. Barriers include they don't have fees, they don't feel safe at school, they don't feel comfortable at school. The distance to go to the nearest school is quite long. Namibia is a vast country. The population density, I think, is the second lowest in the world. So you may find that it's difficult for everyone to have close access to the school. And then the capacity of the caregivers is what to provide for the kids. For any kid to go to school every day, you need someone to prepare for you, maybe make sure that you have bathed, you have eaten, you have food. When you leave home, you have slept well. So the capacity of the caregiver is quite important as well in making sure that these children can get an education just like all of us here. So this is a look at data from the children who enrolled in the OVC program in Namibia under Project Hope Reach from 2018 to 2024. And the sample size in total is about 16,845 orphans and vulnerable children. These were from the 6 regions of Zambezi, Khomas, Umsati, Ohangwena, and Oshikuku. So if you know Namibia very well, the other 5 regions are northern regions, and including Windhoek, which is the capital city as well. So we looked at the data from 2018 to 2024, and then at enrollment, when children are brought into the OVC program through the different entry points, you have a baseline assessment. And in that baseline assessment, one of the things you assess is, are these children who are taking, are they really vulnerable? One of the things we show you that they are not vulnerable, they are vulnerable is, besides the criteria of OVC vulnerability, is also you have to assess their level of vulnerability. How vulnerable is this vulnerable child? If you find that a child is not even able to access school, then the level of vulnerability is a little bit higher. So we assess at enrollment, and then we look at other variables like the age, the sex, is there a difference based on the HIV status? How is the caregiver like? What kind of support can they be able to provide? And some other vulnerable factors, including psychosocial and economic factors. So overall enrollment in the program at entry was around 63% of the children were in school. And then you would see that early childhood education is quite a little bit low. The 0 to 6, only 23% were enrolled in education at enrollment, and then the highest being the 10 to 14 age group, with around 82% of them enrolled in the program. And with regards to the geographical coverage, you would find that a place like Oshikuku, which is a rural place, has about 75% enrollment, while the other places like Tsumeb and Vinduk have quite lower enrollment. These areas are more urban than the rural Oshikukus, so which means that sometimes we shouldn't ignore the poverty or the vulnerability within urban areas as well, and that have an assumption that they're in the urban areas, things should be okay for them, but there are also a lot of kids struggling in the urban areas compared to some rural areas. The lack of support as well from extended families in urban areas, you see that it's another factor which also affects the enrollment in school for most of the OVC. So some of the predictors we saw that were associated with getting enrolled or not enrolled in education included the age of the children of the child. If they have a male caregiver, they are likely going to be going to school. If the caregiver is educated as well, the child is likely going to be in school. And if they have an income source, the income source may mean they have a small cooker shop where they maybe a cooker shop is a place where you cook fat cakes. I think they're called fat cakes in some countries, in Makunya and others. There are different names, but I think we all know them. It could be an income source if they are able to do that on a regular basis. And also there are other different income sources like support from the government, support from other family members. And then what was associated with the lower odds of the child being in school is if both parents are deceased, if there is severe hunger in the household based on an assessment scale which we use for hunger, and then if also there's a history of sexual abuse within that family, or the child had a history of being sexually abused. So what does that mean? We are all here because we managed to get some education. So we have to prioritize that as governments, as civil society, as family members, as communities. We should make sure that we support, that we scale up economic activity within our communities so that parents can be able to support their children. They can provide them with meals, they can provide them with transport. In cases, I know almost all the governments all over the world, they try as much as possible to figure out how to improve the availability of food within schools with support from donors, with support from other partners as well. So that is an important factor which we can work on so that we help the children have access to education. Safe schools. I can't say anything more with regards to the need of safety, social support, and also we make sure that whenever we are in schools, we are providing stigma-free education. Assistance with tuition fee, caregiver support, and also provision of safe accommodation, like hostels where the children can go and stay so that they are closer to the school is quite important as well. So those are some of the things. So in closing, OVC face a lot of structural and psychosocial barriers. Multi-sectoral response is needed for us to be able to assist them, and we should use data to target the most vulnerable populations so that we provide the services they need if we can. And on behalf of the child who was supposed to present this presentation, I say, what more can we do to ensure that no child is left behind? We support the families so that they can support their children get education. Thank you.